Pregnancy is the state of fertilization and development for one or more offspring within a woman's uterus. The prenatal offspring, also called the conceptus, is referred to as an embryo or fetus. A pregnancy can be multiple gestations, as in the case of twins or triplets. Childbirth usually occurs about 38 weeks after conception, or approximately 40 weeks from the start of the last normal menstrual period. Pregnancy is divided into 3 trimesters that roughly approximate specific developmental stages. The risk of spontaneous abortion or miscarriage is higher during the first trimester and lessens in the second and third trimesters. Nutrition and pregnancy. Nutrition and pregnancy refers to the nutrient intake and dietary planning that is undertaken before, during, and after pregnancy. Nutrition of the fetus begins at conception. For this reason, the nutrition of the mother is important from before conception as well as throughout pregnancy and breastfeeding.
Pregnancy stages. A typical pregnancy lasts 40 weeks from the first day of your last menstrual period LMP to the birth of the baby. And pregnancy stages is divided into 3 stages called trimester, which is the first trimester, second trimester, and third trimester. And during this time, the fetus undergoes changes throughout maturation. And for the first trimester, which is conception on week 1, the first sign you're going to have is missed period, which means the fertilization and implantation have occurred, ovulation ceased, and it means that you are pregnant. And during week 4, the baby has started developing. Nervous system, which is the brain and spinal cord and heart, have begun to form. Arm and leg buds begin to develop, and during this time, the baby is already an embryo of 1/25 of an inch long. And during week 8, the embryo have begins to develop into fetus. Major organs begin to form, baby hearts begin to beat, arm and legs grow longer, fingers and toes begin to form, sex organs begin to form, face begins to develop features, and umbilical cord is clearly visible. And during the end of 8 weeks, your baby is already a fetus and nearly 1 inch long, and weighing less than 1/8 of an ounce. And during week 12, which is the end of the first trimester, the nerves of the babies and muscles begin to work together, and the baby can already make a face. And the external sex organs shows the sexes of your babies, and the baby's eyelids close to protect the developing eyes and will not open again until week 28. And the baby's head grows slowly, and the baby is about 3 inches long and weighs almost an ounce.
The second trimester is on week 13 to week 28. Changes a woman may experience. Once you enter the second trimester, you may find it easier than the first. Your nausea or morning sickness and fatigue may lessen or go away completely. However, you will also notice more changes to your body. That baby bump will start to show as your abdomen expands with the growing baby. By the end of the second trimester, you will even be able to feel your baby moved. Physical and emotional changes in women. Some changes you may notice in your body in the second trimester include back abdomen, groin or thigh aches and pains, stretch marks on your abdomen, breasts, thighs and buttocks, darkening of skin around your nipples, a line of skin running from belly button to pubic hairline, patches of darker skin, usually over the cheeks, forehead, nose or upper lip. This is sometimes called the mask of pregnancy. Melasma or choloesma facies. Numb or tingling hands, carpal tunnel syndrome, itching on the abdomen, palms and soles of the feet. You should call your doctor if you have nausea, loss of appetite, vomiting, yellowing of skin or fatigue combined with itching. These can be signs of a liver problem. Swelling of ankles, fingers and face. If you notice any sudden of extreme swelling or if you gain a lot of weight quickly, call your doctor immediately. This could be a sign of serious condition called preeclampsia. Second trimester, the baby at 16 weeks. As your body changes in the second trimester, your baby continues to develop. The musculoskeletal system continues to form, skin begins to form and is nearly translucent. Meconium develops in your baby's intestinal tract. This will be your baby's first bowel movement. Your baby begins sucking motions with the mouth, sucking reflex. Your baby is about 4 to 5 inches long and weighs about 3 ounces. The baby at 20 weeks. At about 20 weeks in the second trimester, your baby continues to develop. Your baby is more active. You might feel movement or kicking. Your baby is covered by fine, feathery hair called a lanugo and a waxy protective coating called vernix. Eyebrows, eyelashes, fingernails, and toenails have formed. Your baby can even scratch itself. Your baby can hear and swallow. Now, halfway through your pregnancy, your baby is about 6 inches and weighs about 9 ounces. Second trimester, at the baby at 24 weeks. By 24 weeks, even more changes occur for your growing baby. The baby's bone marrow begins to make blood cells. Taste buds form on your baby's tongue. Footprints and fingerprints have formed. Hair begins to grow on your baby's head. The lungs have formed but do not yet work. Your baby has a regular sleep cycle. If your baby is a boy, his testicle begins to descend into scrotum. If your baby is a girl, her uterus and ovaries are in a place, and a lifetime supply of eggs has formed in the ovaries. Your baby stores fat and weighs about 1 and 1/2 pounds and is 12 inches long.
And moving on to third trimester, which is the week 28 until the birth of the baby. During week 32, baby development continues. The baby's bones are soft but fully formed. Their movements and kicking increase. Their eyes can open and close. Their lungs are not fully formed, but they already practice breathing movements which occur in the baby, and the baby body begins to store vital minerals such as iron and calcium, and their lanugo, which is the fine hair of the baby, begins to fall off. And during this time, the baby is already gaining about half pound a week, weighs about 4 to 4.5 pounds, and is about 15 to 17 inches long.
Third trimester, the baby at 36 weeks. At 36 weeks, as your due date approaches, your baby continues development. The protective waxy coating vernix thickens, body fat increases, your baby is getting bigger and has less space to move around. Movements are less forceful, but you will still feel them. Your baby is about 16 to 19 inches long and weighs about 6 to 6 and 1/2 pounds. The baby at 37 to 40 weeks. Finally, from 37 to 40 weeks, the last stages of your baby's development occur. By the end of 37 weeks, your baby is considered full term. Your baby's organs are capable of functioning on their own. As you near your due date, your baby may turn into head-down position for birth. Average birth weight is between 6 pounds 2 ounces to 9 pounds 2 ounces, and average length is 19 to 21 inches long. Most full-term babies fall within this range, but healthy babies come in many different weights and sizes.
So for the nutrition dose, number 1 we have folate, which is known as folic acid, and vitamin B9 is an essential nutrient for preventing birth defects. Adequate folate helps to prevent neural tube defects, those that affect the spinal cord and brain. The role folate takes in preventing this defect is most critical during the first week. Much of time and organization dedicated to prevent birth defects recommend to take a vitamin supplement containing 400 micrograms of folic acid per day at least one month before becoming pregnant. And for number 2, we have calcium, which is this mineral is used to build a baby's bone and teeth. If a pregnant woman doesn't consume enough calcium, the mineral will be drawn from the mother's stores in her bones and given to the baby. Number 3, we have iron, which is for pregnant woman, she needs 27 milligrams of iron a day. Additional amount of the minerals are needed to make more blood in order to supply the baby with oxygen. And for number 4, we have protein. So more protein is needed during pregnancy, but most women don't have problems getting enough protein-rich food in their diet. Sarah Krieger, a registered dietitian, she described protein as a builder nutrient because it helps to build important organs for the baby, such as the brain and heart. Experts recommend pregnant women to eat at least 600 grams of protein per day.
For the don'ts, minimize the intake of caffeine for less than 300 mg per day. Avoid high sugar intake and cured meats during pregnancy. Several environmental hazards should be avoided during pregnancy, such as drugs, which can cause infant withdrawal and premature birth. Second, avoid pollution environment as it can cause birth defect and the risk of miscarriage. Third, avoid tobacco, which lead to infant death, low birth rate, and preterm delivery. Also, alcohol that defect the fetal limbs and heart, facial deformities, and intellectual disability.